Trauma to the nose can cause a variety of issues. It can cause a bump to form where there's bone cells that go in to repair a fractured nose. So you're adding more bone cells because the bone is trying to close the gap where the fracture is. Well, that creates a hump because that's a growth center in the nose. So trauma to the nose can cause a dorsal hump, but trauma to the nose can also cause a displaced nasal fracture where both nasal bones, one or both, are crooked. It can cause the upper lateral cartilages in the mid portion of the nose to become inverted or depressed or concave on one, usually on one side. It can also, trauma to the nose can also cause a deviated septum. That's the dividing line on the inside of the nose for airflow. And when you get hit in the nose, it creates a deviation. That deviation is then blocking airflow. There's a lot of things that can happen when you get your nose broken or trauma to the nose from a variety of different issues.